Welcome to this new course on the causes and cures of violence. We live in a time when the urgency of studying violence is impossible to ignore. From the war in Ukraine and armed conflicts in Sudan and Gaza, to the surge of political polarization and extremist violence in the United States and in Europe, contemporary events remind us daily that violence is an ever-present force shaping our societies. Rising authoritarianism, widening economic inequality, and the accelerating climate crisis are fueling new forms of violence that extend beyond battlefields into communities, households, and even the natural environment. All the more during these times of crises, we need a more integrated, systematic study of violence, one that not only explains how violence arises, but also equips us with the tools to prevent it. Violence is one of humanity's most enduring problems, pervading history, culture, and daily life. Globally, more than 1.4 million people die each year from violence, with suicide alone accounting for over half of these deaths. Beyond these fatalities, millions more suffer from trauma, displacement, and non-fatal injuries. The burden is not equally shared. Children, women, and the elderly are the most vulnerable, while 90% of violent deaths occur in low and middle-income countries. This stark inequality underscores how deprivation and systemic injustice fuel violence. Yet violence is not inevitable. Because it is human-made, it is also preventable through awareness, social creativity, and coordinated action. Dr. James Gilligan observed, the most urgent task is not simply to reduce violent events, but to reconsider how we conceptualize violence itself. It has always been challenging to define violence. Without conceptual clarity, however, violence cannot be measured, compared, or prevented effectively. The World Health Organization's landmark 2002 World Report on Violence and Health addressed this issue by defining violence as the following: the intentional use of physical force or power, threatened or actual, that results in, or has a high likelihood of resulting in, injury, death, psychological harm, maldevelopment, or deprivation. This definition emphasized intentionality, widened the field beyond physical acts to include power and threats, and recognized the profound effects of psychological harm, neglect, and deprivation. Sexual violence, for example, is reframed not so much as sexual behavior, but as domination and coercion. Still, definitions should evolve as awareness deepens. Recent scholarship calls for an expanded conception that incorporates structural violence, nuclear destruction, and environmental devastation. I have proposed the following working definition: intentional human action or threatened action, either direct or through structural neglect and diminution of others, that results in or has a high likelihood of resulting in deprivation, injury, or death, or contributes to the extinction of the human species. This formulation, I believe, underscores the reality that violence is not only interpersonal, but also structural, not only episodic, but potentially existential. And if we look more deeply, we will find that the embodiment of structural violence resides in the very social and economic systems that limit survival and flourishing. Some illustrative examples can be given. In Homer's Iliad, for example, war was valorized yet simultaneously portrayed as tragic, revealing how cycles of revenge perpetuate violence without resolution. The Cambodian genocide under the Khmer Rouge demonstrated how state violence can turn massive, where millions were exterminated through killings, forced labor, and systemic social destruction. More intimate but widespread hidden violence is evident in cases of child neglect, where poverty parental incapacity, and institutional failures can converge. Suicide by firearm illustrates the lethal intersection of personal trauma with structural conditions such as gun policy. These diverse vignettes demonstrate that violence cannot be confined within neat categories. Rather, personal, collective, and structural violence intertwine, demanding that we bring a more integrated understanding. So far, the study of violence continues to be fragmented into silos. Criminologists study homicide, psychiatrists focus on suicide, political scientists analyze war, and sociologists examine inequality. However, without integration, broader patterns remain invisible. Ecological frameworks or biopsychosocial models offer useful starting points, but the complexity of violence demands an even broader lens. So this course proposes the biopsychosocial-environmental model, which emphasizes the interconnectedness of the biological level of genes and brain processes, the psychological level of emotions, cognition, and behavior, the social level of relationships and institutions, and the environmental level of natural and built surroundings. This model highlights the reality that violence emerges from dynamic interactions among many influences rather than from a single cause. Among the most pressing conceptual contributions is the recognition of structural and global violence. Structural violence refers to the social arrangements that systematically harm populations by preventing them from meeting basic needs. Relative poverty alone causes millions of preventable deaths annually, far exceeding deaths from behavioral violence such as homicide and suicide. Moreover, structural conditions often serve as incubators for other forms of violence, from domestic abuse to civil conflict. Two existential forms of violence now define our era. Nuclear violence, in which a single weapon holds the capacity to obliterate humanity, and environmental violence, in which climate change and ecological degradation jeopardize human survival. These realities demand that theories of violence expand to encompass global risks. Awareness itself is crucial to prevention. As stated in my textbook Violence, I distinguish between three types of consciousness: alarm consciousness, lack of consciousness, and studied consciousness. Alarm consciousness arises in response to crises, such as the world wars, generating peace movements, but often fading with time. Lack of consciousness is marked by denial or psychic numbing, or by misplaced optimism that violence is somehow automatically in decline. Studied consciousness, by contrast, represents a sustained, deliberate inquiry into violence that contrasts with reactive cycles. It emphasizes proactive prevention and integration into institutions of learning and governance. This sustained awareness is particularly urgent given the persistence of systemic barriers to violence prevention. Violence remains underfunded as a research priority, for example, even though it causes more years of life lost than cancer or heart disease. Cultural normalization, political manipulation, and vested economic interests, from the arms trade to the prison industry, perpetuate cycles of harm. To counter these obstacles, violence must be viewed as preventable, much like any disease. Violence studies should be a discipline in its own right, drawing from criminology, psychiatry, medicine, sociology, anthropology, political science, and public health, integrating insights into a coherent field. This is what we will try to do in this course. The goal is to position violence as a process that we can study, understand, and prevent, rather than an inevitable feature of human existence that we must either tolerate or merely react to. This attitude alone will get us very far. This is because violence is a human-generated problem that can be reduced, redirected, and even eliminated, in my view. An effective response requires multi-level strategies: therapy for individuals, support for families, systemic reforms to reduce inequality, and global efforts to address climate and nuclear threats. Education is a central tool for cultivating studied consciousness and equipping future generations with the capacity for not only preventing, but flourishing. Addressing global mental health is itself a powerful violence prevention strategy, and much can be achieved through supportive environments such as positive school climates. Violence studies, then, is not only about survival, but also about hope, for it offers the possibility of human thriving. By confronting violence as a complex but solvable problem through the integration of knowledge across disciplines, we can redirect energy away from destruction and fighting for survival toward resilience, creativity, and peace. Studying violence is ultimately about studying what it means to be human, acknowledging our capacity for harm while cultivating our equally profound capacity for transformation.